The ProPlege peripheral retrograde cardioplegia device is multifunctional and highly specialized. It is designed for use during cardiopulmonary bypass to provide occlusion of the coronary sinus, to deliver retrograde cardioplegic solution to the coronary sinus, and to monitor the coronary sinus pressure. It has a triple lumen 9 French shaft that is 59 centimeters in length. The device features an articulation mechanism which changes the curvature of the distal tip when the positioning dial is engaged. There are color-coded stopcocks, in addition to lumens, that are labeled to easily identify their appropriate use. The blue stopcock is attached to the balloon lumen. This lumen will serve as a conduit for balloon inflation and deflation. The green stopcock provides luminal access for retrograde cardioplegia delivery, and if needed, guide wire access through the included rotating hemostasis valve adapter attachment. A hose barb adapter is attached to the end port to enable the connection of the cardioplegia line to the cardioplegic pump solution line. The white stopcock is attached to the coronary sinus pressure lumen. To assist in device placement, the shaft is printed with a deflection orientation line and depth markers to indicate how far the device has been inserted. Depth is marked in 5 centimeter increments beginning at 15 centimeters from the tip of the device to the 45 centimeter mark. The balloon near the device's distal tip is expandable to occlude a range of coronary sinus diameters. The shaft of the device is protected by a contamination guard. A distal connector allows for attachment of the contamination guard to the included 11 French introducer sheath. The distal connector also features a locking mechanism to secure the device in place once final positioning is obtained. Additional package contents include a 30 milliliter syringe for flushing and priming the ProPlege device as well as for contrast injection, a 2 milliliter volume syringe for balloon inflation and deflation. It is important to note that the syringe is marked as a 3 milliliter syringe. However, it will only accept 2 milliliters of volume. A hemostasis valve adapter for guide wire placement. When using a guide wire, this valve adapter will be attached to the end port of the green stopcock in place of the hose barb adapter. While a guide wire is not provided, the ProPlege device is designed to be used with a hydrophilic-coated soft-tip 0.035-inch, 0.89 millimeter guide wire with a minimum length of 100 centimeters. Upon removal from the box, visually examine the sterile packaging for evidence of damage. If any damage is observed, do not use the device. Remove the ProPlege device and all components from the package and place on the sterile prep table. Visually inspect for damage. Retract the contamination guard to expose approximately half of the device's shaft. Verify that the device's articulation mechanism is functioning properly. The positioning dial controls the curvature of the tip of the device. Pull the positioning dial back completely to ensure that the distal tip of the device articulates properly. After verifying the functionality of the articulation mechanism, push the positioning dial all the way forward to the initial position. If there are any signs of damage or the device does not perform properly, do not use the device. Tighten the pre-assembled lure connections. When shipped, all lumens, including the balloon lumen, contain air. Air left in the balloon and/or in any lumen may embolize during or after insertion. Therefore, prior to insertion in the patient, this air must be displaced to ensure that only fluid fills these lumens. To de-air and prep this device, perform the following steps. The balloon inflation lumen, which is attached to the blue stopcock, is prepped first. Remove the white cap from the blue stopcock. Verify that the blue stopcock is turned off to the side port. Attach the 2 milliliter volume syringe to the end port on the blue stopcock. Gently draw back the syringe plunger to remove the air in the balloon and lumen. While the syringe plunger is retracted, turn the stopcock off to the device. Remove and fill the 2 milliliter volume syringe with sterile physiologic solution and reattach it to the end port on the blue stopcock. While pointing the open side port upwards to facilitate air evacuation, slowly inject up to 0.5 milliliters of fluid through the port until it is de-aired. Reattach a white cap and turn the stopcock off to the side port. Flip the device over so that the positioning dial is downwards facing the table. This will enable the distal tip of the device to easily be pointed upward during the balloon de-airing process. Hold the attached syringe vertically with the syringe tip pointing down. In a slow and controlled manner, depress the syringe plunger to inject 1 milliliter of sterile physiologic solution into the balloon. Do not inject more than 1.4 milliliters of sterile physiologic solution into the balloon during prepping. Verify balloon integrity and proper inflation. While keeping the syringe connected and held vertically, slowly pull back the syringe plunger to remove air from the balloon. At the same time, ensure that the tip of the ProPlege device is pointed upwards to facilitate air removal through the de-airing hole, which is located at the distal end of the balloon. Do not flick or apply external pressure to the balloon as a means of de-airing, as this may damage the integrity of the balloon. Again, holding the same position, inflate the balloon with fluid by depressing the syringe plunger in a slow and controlled manner, taking care to not inject air into the balloon. Inspect the balloon for air. If air remains in the balloon, repeat the previous balloon deflation and inflation steps until air has been removed. Once all air removal has been confirmed, draw back the syringe plunger to fully deflate the balloon. While the syringe plunger is retracted, turn the blue stopcock off to the device, thus creating a vacuum in the balloon. This step is important to ensure that the tip of the device passes smoothly through the introducer sheath. Remove the syringe from the blue stopcock and wet fill the open port. Fill the syringe per hospital protocol. If the clinician is using fluoroscopy to place the ProPlege device, radiopaque contrast medium diluted with sterile physiologic solution at a ratio of 6 parts saline to 1 part contrast may be used to fill the syringe. This will aid in visualizing the inflated balloon on fluoroscopy. Reattach the syringe to the open wet-filled port. The balloon and lumen are now primed. Flip the device over so the positioning dial is pointed upwards facing the ceiling. Next, the retrograde cardioplegia lumen, which is attached to the green stopcock, is prepped. Besides being a conduit for retrograde cardioplegia, this lumen can also provide guide wire access through an included hemostasis valve adapter attachment. To prep this lumen, first turn the green stopcock off to the device. Remove the white cap from the side port and the contamination cap from the hose barb connector. Fill the 30 milliliter syringe with sterile physiologic solution and attach it to the open side port of the green stopcock. Positioning the hose barb adapter pointing up, inject fluid until a continuous flow exits the hose barb adapter. Then recap it. Turn the stopcock off to the hose barb adapter. Depress the syringe plunger to flush the cardioplegia infusion lumen until fluid comes out of the tip and all air is removed. Turn the green stopcock off to the ProPlege device. Remove the syringe. Wet fill the side port and reattach the white cap. The retrograde cardioplegia lumen is now primed. Next, the coronary sinus pressure lumen, which is attached to the white stopcock, is prepped. Remove the 2 white caps on the white stopcock and turn the stopcock off to the device. Attach the 30 milliliter syringe, which was previously filled with sterile physiologic solution, to the end port. Point the open side port upwards to facilitate air evacuation. Slowly inject fluid through the side port until it is de-aired. Reattach a white cap and turn the stopcock off to the side port. While pointing the tip of the device downwards, flush sterile physiologic solution through the coronary sinus pressure monitoring lumen until all air is removed. Visually verify that fluid is dripping from one or more of the holes at the distal tip of the device. Turn the white stopcock off to the ProPlege device. Remove the 30 milliliter syringe. Wet fill the end port and reattach the white cap. The coronary sinus pressure lumen is now primed. The ProPlege peripheral retrograde cardioplegia device is now prepped and ready for use.